the subject. All right, Attila, over to you.
Thank you very much, Archana. Good morning, good afternoon, and good evening to everyone. We have another very interesting webinar today. This is on household surveys and geospatial data. And we have our DHS colleagues presenting the methodology that they have been using, also how they analyze the data. We will be watching the presentation with a lot of interest. We have Trevor, Ben, and Trinadh today. For those of you who may not know, Trevor was in UNICEF before. Until recently, actually, I worked with him in DNA. When I say recently, I'm talking about 16 years ago, but that's recent. So Trevor is no stranger to UNICEF. He actually oversaw the mixed program at that time together with myself. So very pleased to welcome back Trevor to a UNICEF platform. And thanks to Ben and Trinadh for joining this presentation as well. So looking forward to it. I will come back during the Q&A session, but then let me give the floor to Archana now to tell us a little bit more about the presentation and some of the ground rules that we would have to go with. Archana, over to you.
Thanks, Attila. So today's webinar is entitled Geospatial Data and Household Surveys, Experience from DHS. My name is Archana, and I work at the Data Collection Unit in Data and Analytics section. This is the 5th webinar that we're having in this series, which we started in April. So today's presentation will provide an overview of how the DHS program is implementing geospatial modeling techniques that use geolocated survey data and spatial covariates to better estimate key indicators at the subnational level. The presentation will detail the GPS data collection process, how geolocated data are used, and the spatial modeling methods for producing subnational level estimates. As Attila mentioned, we have 3 presenters, Trevor, Trinadh, and Ben. A little bit about our 3 esteemed panel members. Attila already spoke a little bit about Trevor, but maybe I can give a little bit more detail. He is a senior technical director with ICF International working on the DHS program, and he provides technical assistance for the implementation of household surveys. He has 42 years of experience in international survey data collection, processing, analysis, and dissemination of results. He has worked for DHS from 1987 to the present, with a break from 2003 to 2005, when Trevor was Chief of Strategic Information, which is now called Data and Analytics section here at UNICEF, which included overseeing the implementation of MIX, as Attila mentioned. Trevor started his career as a data processing specialist for the World Fertility Survey program. A little bit about Trinadh. Trinadh is the Geospatial Research Lead at ICF, working on the DHS program. He has more than 7 years of experience conducting geospatial analytical research and is proficient in a suite of software, including ArcGIS, Stata, and R. Trinadh has 5 years of experience managing the collection, processing, and public release of the DHS program's GPS data sets. He manages the production of spatial interpolation surface data sets and plans and facilitates geospatial capacity strengthening workshops. More recently, he has been investigating a population-based alternative to the DHS program's existing GPS displacement method. Last but certainly not least, Ben is a geospatial research scientist with over 16 years of experience applying geospatial techniques and tools to model diseases and demographic and health indicators. His work experience includes positions as geospatial research manager, a senior geospatial research scientist, data manager, and fieldwork supervisor. He has been a principal investigator on various projects applying geospatial technologies, and Ben has used geospatial modeling methods and R software to link the complex interactions between health indicators and environmental, climatic, and socioeconomic factors. He has conducted several scientific research and established a record of publications in peer-reviewed journals. So before we begin, just a few housekeeping points. We have scheduled about an hour and a half for today. We'll start with the presentation, followed by the Q&A. As always throughout the webinar, kindly remain muted and write your questions in the chat box. We'll try to group the questions and direct them to the panelists during the Q&A. So We will have this available on our SharePoint site, which is available for UNICEF staff. However, we do plan to have this also available on our external YouTube site soon, so others can also take a look. So that's it from my end. Trevor, Trinadh, and Ben, over to you.
Thank you, Archana, and thank you, Attila, for the kind words. It's great to be working with UNICEF yet again. So thank you very much. So Ben, let's go to the next slide. So I'm going to give a very quick overview of the DHS program first. It's a project that provides technical assistance for the collection and use of data to monitor and evaluate population health and nutrition programs. It's a USAID funded project, which has been going since 1984 now. Very similar to MIX in its scope, and there's a lot of overlap in what we do both in MIX and DHS. Next slide. Most of you are familiar with the DHS surveys, but we actually do 3 different kinds of surveys on a pretty regular basis. The DHS, which you know, which collects information about fertility, mortality, family planning, and many, many other indicators. And then we also support malaria indicator surveys, which are slightly smaller surveys that are focused on malaria, and particularly around mosquito net use and prevalence and treatment of fever, and includes testing for malaria. And then thirdly, we also conduct a different kind of survey that is a facility-based survey of facilities providers and clients, looking at service infrastructure and service availability in those facilities. Next slide, please. So this is a brief history of DHS starting in 1984, and we're currently in DHS 8, which runs from 2018 to 2023. Next slide, please. So today we've conducted more than 400 surveys in over 90 countries. I think the map of the mix would look pretty similar to this too, with the numbers of surveys that have been completed. The 2 programs are very similar in this respect. Next slide, please. So we've been collecting GPS data since the 1990s. And using that data in our analysis. And the use of a geographic information system permits the linkage of DHS data with many, many other data sets. It really broadens what you can do in your analysis of data. So it's become a key element of what we do in DHS. And Ben and Trinadh are going to explain that in more details in a minute. Firstly, I want to give you a link to look at spatialdata.dhsprogram.com. This is where you can find all of the GIS data that DHS supports. And there you'll find boundary files for different the DHS regions that are in-country regions that we use. You can access data in a GIS format for simple mapping, and you can see some of the examples of model surfaces that we produce from the data and of covariate data being data from other sources that can be linked directly to DHS data. So these are just a few of the things you'll find on that site. Collecting GPS data, though, is not without its challenges, and Trinadh is going to talk about some of the issues with GPS, collecting GPS data. Over to you, Trinadh.
Thanks, Trevor, and thanks everyone for having us here. As Trevor said, there can be a lot of issues collecting GPS data, and the way that we've done so at DHS has evolved over time. As you see on the left, we have those handheld GPS receivers. We used to use those when we were doing paper-based surveys. And these are just handheld units that the fieldwork team would be carrying around. And they're relatively accurate within 3 meters. But as we moved over to the CAPI-based, computer-based data collection method, we started using these USB dongles that you're seeing on the right that just plug directly into the tablet and can be integrated with our questionnaire, our program. And that way, rather than having to manually take out the receiver and take your GPS point, it's just part of the survey process. You'll get a prompt, just take the point, and then continue on with the questions. And now we're actually, as we're moving into using Android tablets for this work, it has a GPS unit built into the device itself. So you don't even need this extra USB dongle anymore. Next slide, please. When we get the data from the fieldwork team, we have to make sure that the data are actually valid and are accurate. So some of the issues that Trevor mentioned that can that we have to keep an eye out for is maybe the unit, when it was turned on, didn't have enough time to accurately calibrate with enough satellites, and so the measurement may be off by a little bit. Maybe the fieldwork team forgot to take the point. This is not as much of an issue now that we're doing CAPI-based, but before, when it was paper-based and they had the handheld receivers, they may have forgotten to take the point, so they try to just go back to the same spot or close by and take the point, or they just recently turned the unit on and it's still using its last known location, which is back in the field office. And that's why you'll see points when we get it for processing, why they're hundreds, thousands of meters away from where they should be. So it's our job then to make sure that those points are validated and make sure that they are as accurate as they can be. So the points are collected now at a household level. Typically one measurement for each house in the cluster, and then we aggregate it up to 1 point for the entire. When we do that, identifiable information, that point, even if it's aggregated for the entire cluster of house, it's still giving you a general location. So what we do is first take that raw data, and we will then validate it against other information that we may already have. We have shapefiles for the administrative boundaries for the country of interest. We validate the point down to the administrative 3 or 4 level, or even lower if we can, if it's available. And once that's done, we then apply a displacement protocol, which I'll go into in a moment, which will just move the point a little bit. And the purpose of that is to make sure that it won't immediately where the survey respondents are. Some of our surveys have more, collect more sensitive information. We don't necessarily want that easily identifiable to someone who's downloading the data sets. We are very involved with the process of guiding the GPS data collection from the very beginning of the survey process. Are in constant communication with the field teams in country, and we'll be checking the data as it's coming in throughout this data collection process to make sure that we're catching these issues early on. And once we've validated it, we will then apply the displacement and release it via the website. And you can see here an example of what that looks like, the data download page. And it'll be available for public use on the DHS website. People just make an account on our website, and they'll be able to download the data. Next slide, please, Ben. So I mentioned displacement, also called geomasking. There is a more in-depth explanation of this process in our Spatial Analysis Report 7, and link there in the slides if you wanted to go ahead and peruse it. Next slide, please. Actually, before you do, Ben, sorry. But what I was going to show you here in the next slide is that the displacement protocol, as we have it, is addressing urban points are drawn. A circle is drawn around urban points with a radius of about 2 kilometers. And what we do once we do that is that we have a Python script that will select a random angle within that circle, and it'll push the point at a random angle and a random distance within 2 kilometers. For rural points, we draw a 5 kilometer circle, and the same thing is done. And then for a smaller 1% of rural points, it's a 10 kilometer circle. And the reason we do that is just to better protect the privacy of our respondent when we it's not possible for users to every rural point is within 5 kilometers of the original point is, because some of them are up to 10. You can't really tell which one is 5, which one is 10. So that's why we do that. But Ben, if you can then now go to this animation will make more sense now that I've explained what it does. So you can see the actual point. You choose a random angle. You draw a random. You pick a random distance up to 2 kilometers, and that's where the new location is for an urban point. For rural, a 5 kilometer circle is drawn, random angle, move to a random location. And this is our existing displacement method. It's been in use since I think 2010 or 2012, and has been adopted by a number of other groups that are in household survey work, doing GPS data collection. Next slide, please, Ben. And while it's been in use for quite some time, we also feel like there's opportunities to improve on this method. So recently we've been investigating a population-based approach to this, something a little bit more sophisticated and something that's a little bit more tailored to real world situations. Not every urban point is the same, definitely not every rural point. So we've been doing some work looking at how we can use population data from different sources and create a displacement protocol that is accounting for the population dynamics of our survey countries. So pretty recently, we've worked with the World Bank on a guidance document for the UN Statistical Commission. The kind of we've done and what we can do in this space, and there's a link for that as well in the presentation. And at this point, I will hand over to Ben, and he'll tell you more about how we actually use the GPS data that we collect.
Yeah, thank you, Trinadh. And so I'm just gonna spend, I think, time talking about how we, I'll just give a general overview how we use the DHS geolocated data, and now I'll discuss more into detail how we use the geolocated data and the spatial modeling methods to produce admin to estimate. So we can use geolocated data to link other sources of data. I think as Trevor mentioned, you saw this slide, these maps, but showing is just the different covariate, satellite images. For example, showing the enhanced vegetation index, showing the land surface temperature, population, and also showing the elevation. So you can extract and add covariate values, such as this one I mentioned, to your geolocated survey data. The output of the extraction is very useful because you can use it, to conduct further analysis, and for here, I think it's good to emphasize that the extraction table is useful for people, for everyone, like scientists and analysts, and you don't need to have much knowledge on the geospatial techniques. Like you don't need to be a GIS expert to use this kind of output to conduct your analysis. So this is very useful because it's not only having GPS data, but again, to what other multiple data sources you can link your GPS information. Also, we can, the geolocated data allows us to measure distances to, for example, health facilities, schools, maybe water sources, places like markets, and other features which I think they're also relevant if someone is conducting a particular analysis. And of course, I think one of the indicators that we collect in our DHS data is to do with some of the wash indicators. Like we would like to know, for example, what's the time someone can access a water source. But I think if you have a GPS, you can also try to add up the distance for someone to access water sources. We can also identify the spatial distribution of the health services that are being provided in a particular area. And from that kind of analysis, you can now determine which areas they need maybe more services. And this information, of course, is very useful for planning activities, especially in some particular countries or districts whereby they want to make sure that we have services available in all our district. I think planners, they can use this kind of output. Also, one thing that I'm going to talk more is the spatial interpolation. So we can use the geolocated data to model, to create model surfaces at a high resolution for different indicators, and we can the output from these model surfaces, they're very useful, and we can produce estimate at any geographical level. And of course, I'm going to talk in detail, I think, the next few slides. Also, we can detect, like spatial clusters of a particular indicator of a particular disease in a geographical area. So, for example, you have a country, and then they say, okay, where are the areas with the high malaria clustered in a particular region or in a country? Are they like in the west or south? There's things like that. So this is very important output that I think can be also used for planning purposes, and the targeting intervention. So now, after giving you just an overview of the different uses of geolocated data, now I want to focus more how we can use this data to produce admin 2 level estimates. As I think Trevor mentioned, like DHS, we conduct surveys, and most of our analysis are done at the national level, as well as the first subnational admin level, or this could be like a region, or could be like a province. So national level aggregation or estimates are more useful for comparing nations, aggregating across large world regions, and hence their natural audience could be, it's mostly international policymakers and the donors. And also in terms of the admin 1 level, like the map on the right, the analysis from this does not provide a comprehensive estimate that can be used, for program and the implementation. For example, we know many countries, they would like to they'd like to intervene more at a lower level, but I think a regional level is not that much useful. So we think that admin 2 level could be the most appropriate for program implementation. And so the data, as I said, so they are needed, for program planning, implementation, and monitoring and evaluation in many contexts. So possible approach to have a data at a lower level, we either, number one, we scale up the national representative survey data collection process, and this is by probably increasing the sample size, and of course issues like cost should come in, and also time. So like we're going to spend a lot of time if you're going to increase the sample size, we're going to spend a lot of time in the field work. Another option could be maybe we use the data derived from the Health Management Information System, HMIS, maybe from health facilities or communities. For instance, we can say data to determine the vaccination coverage in a district, things like that. But also another option could be now to, as I mentioned, use the GPS location and then create spatial interpolated maps that uses, modeling techniques to predict values to areas where they were not surveyed. So the looking into this all 3 approach. So the first approach is not feasible, especially in the area whereby they lack resource, and also the second one, the HMIS data is not always reliable, and is not easily accessible in some countries. And we have seen it, there's a lot of inconsistencies across different countries. The third approach, as I said, which uses spatial modeling techniques, has become increasingly popular in mapping key development indicators at high spatial resolution. And of course, there's low cost when you decide to do this kind of work. You just need computer capable of downloading data, high resolution satellite images, and then you need a software to run this kind of models. So as we said, DHS survey, we collect the GPS data. So we want to take advantage of the geolocated data to run the models. So just to give you an overview, what is the spatial modeling basically? So the basic idea here for the process to predict, like you have a given location, let's say a cluster with information that has been observed. So you want to apply these techniques to produce or to predict the particular indicators to area whereby we did not observe any kind of information. So for example, you can see here we have the far left, we have a map showing a sample, points that we have collected with the GPS, and then now you apply the interpolation techniques, and then the output is the model surfaces. So this is a very simple approach, and of course we call it kriging. Basically, you just have your point, run the interpolation, and then you have this kind of output. So I want to now go explain more by providing an example of a case study that we run this kind of analysis, and we used the Zambia DHS 2018 that was conducted in 2018 to model the wash indicators. And in the end, I think I'm going to show you also resources that we have done this kind of work. We have reports, but for now, I'll just focus into the recent project that we did on wash indicators. So basically, the idea here was to explore how we could use Bayesian model-based geostatistics to model DHS indicators. Don't worry about these big terms, but I'll try my best to not to go into detail. So the idea here, we used ensemble machine learning techniques. So this is just a combination of different models to run a pixel level output. When I say pixel level, basically, I think if I go back to the slide, so this is basically pixel level output. So, and then using the pixel level output, we produce estimate at admin 2 level, and of course, measure some the uncertainty from our output. These are the indicators that we selected, and we worked with the USAID, the Geocenter, and I think they're more interested into these indicators: improved water source, the water treatment method that are being used, place for hand washing, if a house has the soap available for hand washing, time to source, to water source, and also improved water on premises. In fact, this analysis came just, I think, few days before the pandemic, or maybe after the pandemic, and I think they were like very, very useful now to see, okay, these are all related to, people washing hands, stuff like that. I think it's very good to look more into this kind of output. So it was a very useful analysis that I think the country could use for future planning purposes, to see the area whereby they lack this kind of services, whether now increase or take more measures. Also, we had the sanitation indicators to look into whether like improved toilet, non-share toilet, and also we looked into the worst index. And as you know, we have 5 classes in the DHS, but we looked into the lower and only the higher worth index. Now we have had this geospatial covariate. I think also Trevor mentioned, and also I mentioned in the last few slides. So basically, these are satellite images that they are publicly available. You can go to the source and then download this kind of data. So this is what we used for our modeling approach, and you can see I don't want to go through the list, but one thing that I want to mention that they come from different sources. So one of the tasks that we normally do for us now to be able to use excuse me, to use this kind of data is to process them, to make sure that they are all in the same scale. So the first thing we have to reproject. So basically using you put them in the same coordinate system, and once we have the projected raster, we extract to make sure that they fit to a country boundary, and then the last part we aggregate, or we say we sample to make sure that they are the same spatial resolution. So as you can see the example here, we have a global covariate. I think this is temperature or maybe NDVI, and then now the task here was since I'm working on Zambia, I wanted to make sure that everything that I'm working, it fits on the Zambia border. And that's what we did for all this covariate. So I'll just now give you an overview of the modeling process. So first, as we just said about having the spatial covariate, and then how we can link with the geolocated data. First, we import the covariate and the survey data put together in R, and then once we have that, we extract the values. So basically, you have your GPS location with the lat long information, and then you have the whatever tiny covariate, and we have to make sure that for each GPS location we have the value of the covariate, and then the output is the data table which have now your geolocated table with the covariate values, and then we use the ensemble approach or the machine learning method, whereby we run models, and we run different types of models. For here there are 3, and I think I'm going to explain more in the next few slides why we do this. So just to give you an overview why we say the ensemble of machine learning techniques, basically we use this approach to increase our predictive power in the covariate, and also to capture the nonlinearity effect and the complex interaction between the covariate. So these are the 3 types of models that we used, and you can get like a very good detailed description of this kind of approach from our colleague Samil Bhatt from the Imperial College, whereby he came up with these wonderful ideas. So once we run the models from the different, we call some models, and then we have the output, which again we use that. So we use that as a covariate into our final model. So let me show you here what we do. So as you can see, different models have different strengths. So the GAM you see is kind of like different from the second one, also different from the third one. So from the interpolated maps, we see that each algorithm has a different prediction. So now the question here will be, which model is right or best for someone to rely on? So the predicted surface from the submodels used now into the Bayesian spatial model using integrated nested Laplace approximation is R2, and we use the Bayesian because it's a provide robust modeling approach, and also the advantage of the Bayesian compared to the Kriging, it takes into account the uncertainty. So this is our modeling approach or equation. I don't want to spend much time, but just to give you a brief, it's a logit function with 2 types of error. So we have the intercept, and also we have the covariate, and then the coefficient, and then the z we have the ZI, which is modeled as a Gaussian processing, and also we have the other, which is the non-spatial error. So for the Gaussian processing, so just to give you again a brief. So if we have two locations, we say that if we have two locations that are close together in geography or in term, they are somewhat related. They have similar characteristics. So that term we call spatial autocorrelation. So to take into account into analysis the spatial autocorrelation, that's what we model, using a Gaussian processing with a covariate function between the two clusters. So this is the where we implemented our model is a package called, as I said, ArcGIS. It's just you can download just to have some ideas how it does. You don't need to go too much into the details of the functions and stuff like that. So once we produce now once we run the Bayesian model, we produce a prediction at a pixel level. And of course, as I said, also we have the uncertainty map. And then from there now, you see what we have. So in the, I think in the previous, I had shown different maps, but I think from the map now, from those three maps, we come up with, this one, which I think it shows some, try to text probably it tries to take, I think, the differences from the three maps. So I think it's good now to, instead of just depending on one model, and the one set of strength, I think you use map models and combine the output. So the mod output, of course, as I said, is a prediction map indicating the indicator prevalence. So here, of course, you can just do by 100 to get the percentage values, but that's what we see. So this is the general idea from the stacking approach. So this one just shows you now overall the entire modeling approach, the different steps, what we do, but mainly just understand the first part here, geolocated data with the covariate, and then you apply the modeling approach. You have the pixel level, and then you aggregate. So this is the next part I want to talk. So you aggregate now using what? Using gridded population data. I think there are also satellite data which are available from the World Pop, Southampton University. And then from that, we produce, again, the subnational admin level 2 estimate together with uncertainty of the admin 2 level estimates. So in addition to the, so this is addition to the pixel level. So we produce now the subnational level estimate, as you can see. So we have the different indicators like the improved water source in Zambia. You can see areas whereby we see they have higher prevalence of or high values of improved water sources, and area whereby they have low. Same applies for soap in the water. So you can see which areas where they lack this kind of indicator services, and also places to wash hands. You could also see, is the country doing well, or there are places that we need more emphasis. Same applies also for the other different indicators. You could see the different values, estimates for each district. Again, here for the improved toilet, the wealth index, the higher and the lower, still you could see. And very interesting here, you can see like we see most of the areas they have, I think the wealth index is lower, and this is, I think, is expected for, I think, for many countries. The last part that we produce, very, very interesting, we summarize also our admin 2 estimate with the confidence intervals, in a table, which I think is is very useful now for people like in the countries whereby you cannot understand the map. You can just go to a table to go to a district name or a district district name, see the or the mean estimate from the indicator, and then the upper and the lower intervals. Next, now I want to, after giving you a brief of the modeling approach, just want to point out, I think as we have mentioned in our previous slides, that so the GIS data are publicly available with the permission on our DHS Spatial Data Repository. So the repository provide guidance, how you can use the GIS data, and you can visit. I think you were given the link. Again, I'm giving it here. You can visit to see, how you can go to each product, like how you can explore each product to see what we have. For example, these are the boundaries that we have. It's admin. It is at admin 1 level, but I think for GIS users, they can download the boundaries, or you can download the GIS boundaries and then use in the GIS software. Also, we have a product like the indicators we're showing, like you can see for single country, you can see for many countries, or you can see all countries. And also interesting again about the stuff I just mentioned, the interpolated surfaces. We have them available for, I think, for many countries, for different indicators. So from this one, basically you have the option to download as a raster layer for the GIS users, but if you are not, you have the option also to download as a PNG, and then of course you can probably make in your presentation or add in your report. So please try to visit the website to see what kind of indicators, which country you might be interested, and of course you can be very, very useful to you. And also, as I mentioned about the geospatial covariate, you can also obtain this kind of information. So basically, we have a list of geospatial covariate. I think you can follow that link to see what we have, addition to what I think I just presented, but you can see more. And the advantage of this covariate, what we do at the DHS, we do the extraction for you. So it's like you don't need to go to the source, download, and then process. No, so for each country, basically we run the extraction, and then you have now, for example, your country lat-long information and the different set of geospatial covariate. So this helps even if people are not a GIS expert, to be able to run analysis using the geospatial covariate. Now you can see the advantage of geolocated data, because without GPS we couldn't have, we are not able to, to link this geospatial covariate data set. And also we have another set of data I think we normally get from USAID showing the population estimates. You can also visit and then download to see. This could be probably useful to you also. Now I just want to briefly talk about what other institution, because we are not the only one doing this kind of work or using the geolocated data. We have so many institutions that they use our geolocated data, and I think just the University of Washington with the wonderful project, the IGMI. I think we all know Professor John Wakefield and the team. They produced the subnational under 5 mortality estimates from 1990 to 2019. A very useful data, like very, very useful data, but it is at admin 1 level. So there's other, analysis that we like to go more into probably a lower level. And just to inform you, we're working with John Wakefield to try to see how we can go to a lower level, producing under 5 mortality estimate. So maybe IGMI can be updated in the future. So also the University of Washington, they also run, or they use the geolocated data to do other small area estimation, for example, for the vaccination coverage or some malaria modeling. And also the Institute for Health Metrics and Evaluation, they have done a lot of work just to model various indicators for low and middle income countries. And just to brief you, like the approach that the DHS is using, I think we've been working with the HME to come up with this kind of estimates. Also, our collaborator, the Malaria Trust Project, they've been using the same approach to estimate the spatial distribution of Plasmodium falciparum malaria endemicity, and also they also model the ITN coverage, also the model so many indicators just related to malaria. Another very useful, I think, output that they have used our geolocated data is to model access to populated places and also the travel time to health facility. This is very, very useful. I think if you guys need a link to that, please don't hesitate to contact us. We can provide the link for this kind of data. It might be useful to you too. Also, Imperial College, they have done modeling on HIV, but also some work on malaria. As I mentioned, University of Southampton, particularly the World Pop Project, they produce a high-resolution geospatial data on population distributions, which is a very key data set for researchers because we get total population for under 5 for different age. I think is very, very useful. Also, the Kenya Medical Research Institute, with the Wellcome Trust, I think they've been modeling malaria prevalence, the ITN coverage, and also they are doing some interesting work on healthcare accessibilities. And they link, this kind of output now with the different services that are being provided in the countries. And I think it's good also to see this kind of output. The University of Science and Technology in Norway, we also working with them, but also they have done a very, very interesting work, especially developing the ARA-INLA package, but also I think they have worked with in the IGIM project, especially developing the spatial temporal under 5 mortality method for estimation package we call SAMA. So these are the group also working with them. Also, the University of Basel under the Swiss Tropical and the Public Health Institute, they have done a lot of malaria work, modeling prevalence of malaria. Also, lastly, the USAID Geocenter I just mentioned, we worked with them on the WASH indicators, and also the Avenir. We have done a work with them on family planning indicators. So these are all interesting work that we have done. So just to give you the last part, I work for you guys to see the resources that we have. I think some of the report we have mentioned in our previous slides, but all these are different reports that you can read. And if you want to have details of the stuff that I talked about, the modeling approach, Spatial Analysis Report 11 and the Spatial Analysis Report 17. So 11 gives you the modeling approach at the pixel level, and then the 17 is kind of explains most all the stuff that I presented here. These are the references I think you guys can try to read. I have mentioned the Samil Bhatt paper, which is very useful. And thank you so much for listening. And yeah, we're ready for questions.
Thank you very much, Ben. Thanks, Trevor. Thanks, Trinadh. So we're at 9:23. We have more than half an hour. We had allocated an hour and a half for this webinar. So we have until 10 New York time. We have a number of questions and comments in the chat box. We had a number of questions from before the presentation, the webinar. And also, I will give the floor in a minute to our lead geospatial collaborator in the mixed program, so that he can take the floor and ask a few questions and maybe comment also. So let me try to start with the questions in the chat box, but also Ben, Trevor, Trinadh, please do have a look at the questions yourselves too, to help me out on this. So the first question that I would like to voice is are distances to water sources, health services calculated before or after the geomasking? If after, what are the implications of this? I will, for the time being, go one question by one, and then we can group the questions, and maybe we can respond to a group of questions. Over to you guys to respond to this first one.
Ben, can you take that question?
Can you hear me?
Yep.
Yep.
Yeah. So you asked whether the distance to water sources are calculated before after the geomasking. Basically, we the first thing that we do, we geomask our locations, and then we release for public use. So basically, we do calculate after the geomasking, and of course, we have seen some implications, and what other people they have done is to try to take into account the geomasking into their analysis. So, for example, you apply the 5K or the 2. Basically, mostly they do the 5K just to take into account the geomasking up the displacement process into the analysis. So we have a challenge basically for distance measurement. Yes, especially people wants to have like the actual or just something that close to the reality. Yeah, we have been getting a lot of questions and some complaints, like people they want to have the original data, but in general, unless if the analysis is like at a very lower level, but I think we have seen in so many analyses still the displaced data works for computing the distances.
Thank you, Ben. Another question relates to the following: How do these uncertainty ranges look for the pixel level maps? I have seen examples with very large uncertainty ranges, which makes the interpretation of the data rather difficult. Uncertainty around the maps.
Yeah. So yes, I agree with that. So a pixel level, yes, you can find like a huge range of uncertainty. But I think what we've been trying to do is to make sure that we apply modeling approach that we modeling approach that take into account the uncertainty at pixel level, but also depends on the indicators that you modeling. So in areas whereby you don't have that much data set, yes, you might have this kind of huge uncertainty range. But I think one thing that we have seen is helping us in this modeling approach is to make sure that you have other data set that you can use, and they can help you in your modeling approach to make sure that at least you don't have that a huge range. So I would just say method should be very, I think should be a number one, like which kind of modeling approach you're using. So for example, if you just do a simple kriging, you're going to expect to have this huge range. But I think now if you tap into this new approach that we're really trying to use and make sure that you have enough simulations, I think we've been trying to make sure that we've been getting like results, and of course trying to make sure that I think the uncertainty is not that huge. But I agree, so the only thing here, careful with the I mean, we need to focus into the approach, but again also don't just do one run. So you have to make sure you do several models before you decide, until you said, okay, at least now I'm getting, a result that makes sense. So that's why you need to put more time, into this kind of, modeling work. Yeah.
Thanks, Ben. Maybe I can also go to a question that came from before, which is about displacement. You actually talked about an alternative method of displacing using population information. Can you expand on that a little bit? And maybe while you do so, maybe it may be a related question that came in the chat box, which is, have you had any experience with using the DHS geospatial data with the new concept of degree of urbanization?
I can speak to the first question about kind of going into more about the population aspect of the displacement. Essentially, we were looking to see if our urban points, by and large, tend to be displaced excessively using our 2-kilometer parameter. Especially when you look at our extremely urban points that are in kind of larger cities, 2 kilometers can be a huge distance. And conversely, we were seeing that rural points, when you displace them 5 kilometers, depending on how rural the cluster is for the especially remote areas, that really doesn't do that much, because there aren't that many villages or rural locations that are close enough together that you can say, well, I don't know which one this point comes from. Within 5 kilometers, you could probably guess if you wanted to. So what we were trying to do is, by utilizing population data sets, primarily from WorldPop, can we better displace data based on the population data for that country? And what that does is that it no longer relies on the distinctions of urban and rural. It only relies on the population for that cluster or for that area. And so what we'll hopefully see is that urban points will no longer need to be displaced, up to 2 kilometers. It could be much less and still hide your respondent among enough people that it's still protecting their privacy. Whereas rural points, maybe we do need to displace them a little bit further than they currently are. And that does have implications for analysis. And that's part of what we're trying to figure out, is how much can we displace these points more than we currently do for rural clusters without really impacting the analytical utility of the data set. So we are coming up with this tool that will essentially just read the population under the undisplaced point, and if it hits a certain threshold, it'll then draw a circle around the point and displace within. If it doesn't, it will draw a larger circle, measure the population again, and then it'll keep repeating that until it hits that threshold, and then it'll displace within that circle. So it's more or less similar to what we currently do, just adding that extra layer of complexity in. And Attila, could you remind me of the second question, please?
There's work ongoing, as you know, as you may. I think you have been involved with it as a DHS program on the degree of urbanization. I think led by Eurostat. They've been looking at redefining, by using geospatial information and population information, what's urban and what's rural. Is that in any way incorporated into this work?
It's not directly incorporated into what I've been doing with displacement, but Ben, I think you can actually speak about our SAR from last year about urbanicity, and that might be related to that.
Yeah, I think concerning the project, I think we need to get more information into that. I think we like for the kind of work we're doing, we haven't been involved into that, but I think it would be good. I know there are interested people have been looking into how should we define urban or rural. So last year we came up with spatial analysis report, we are trying to model, okay, which indicators could help us to define better urban and rural. So we picked some indicators, just ran some models, and to find out, okay, is there any differences, or which definition like DHS could adapt into, or the countries could adapt, because if you take the different countries, they come up with different definitions. A definition in Kenya is totally different from a definition of urban and rural in Nigeria. So I think that was our idea, but I think I'll take more look into this project and see how we can I think add or relate to the analysis that we conducted last year.
Thank you very much, Ben. A couple of questions could be related. The first is, this is great work, obviously. I don't think anyone has any questions about the importance of this and the groundbreaking nature of this work, for sure. I think most of the questions which are coming are about how exactly it is done. And in relation to how, where is this? Who is involved in doing this work in DHS? Is it done at the country level? Is it done at your level only, and provided to the countries? Who is actually involved? And somewhat related to that, we know that sometimes, as the mixed program, as I'm sure you have it with the DHS program too, we have country sensitivity about the public sharing of data. Not geospatial data, but the regular DHS or mixed data. And our observation sometimes is that geospatial data is even more, countries are maybe even more sensitive to the public dissemination of that data. Do you have challenges in that, in the public dissemination of the data?
Maybe I can.
Yeah. Go ahead,
Yeah, maybe
Trevor.
I can answer this question. Not really. One of the things that we always do is agree on a terms of use of the data prior to the start of a survey. So in either an MOU or a subcontract or whatever mechanism is being used, we'll specify, what the agreements are about the use of the data. So we address that ahead of the survey, and it's put in writing and it's agreed to and signed off on. So the release conditions are set before the survey takes place, and that includes the GPS data. Now, we don't release, as we said, we don't release the undisplaced data. We are very, very keen to ensure that we preserve the identity of individuals and protect their identity. So the displacement of the GPS data is one of the things we do in terms of ensuring that we can protect the identity of the individuals. So we haven't really had too much of an issue with that in most places. It's all discussed ahead of time. There have been one or two countries that do not want to collect GPS data, but those are increasingly rare, and GPS is collected in almost every survey these days. Does that answer the question?
And yeah, and it's very good news that you don't have much of a challenge in that. And who actually undertakes this work? Maybe the first part of the question to answer.
Yeah, this work, the work that Ben and Trinadh have been presenting is currently largely done at the DHS global level at this point. The methods that Ben's been talking about, many of these things are still very much under development, or kind of have been developed but are being refined. Some of the aspects that Trinadh talked about in terms of the processing of the GPS data, we could move more of that to the country level potentially, but in terms of the modeling aspects, you need some very, very strong statistical skills, skills in geospatial modeling. And to be honest, we don't find that a lot in the locations we're working in. So the challenge is there. We are working towards coming up with approaches where we can provide the code to do this and to make this more routine. But it's going to be essential to have people with really, really strong statistical skills, geospatial statistical skills, to be involved to actually make use of these in the longer term. So that's a big challenge. It's at present, it is work that's largely done at the headquarters level.
Thank you very much, Trevor. At this point, I want to give the floor to Jan. Jan is our geospatial data expert who has been collaborating with the MIXT program. I know he has a number of comments. Jan, would you like to take the floor?
Mm-hmm. Yeah, sure. Thanks, Attila, and thank you for a great presentation. The whole work and the whole project is really amazing. But two parts were especially interesting from our point of view, I think. Because as Attila has mentioned, we've already started a project aimed at geo-enabling our MIXT workflows and procedures. And part of this is also we've just completed the development of a script in the form of QGIS plugin for this geospatial displacement. So it is very similar to the methodology is very similar to what you have implemented. Just some minor changes or differences. So we've seen that, for instance. Different surveys provide the data in different formats. So sometimes this is just a list of coordinates in CSV file. Sometimes it's a shape file, point shape file, or sometimes we have more than one point per cluster. So we actually added some additional functionality that will help us automatically generate cluster centroids depending on whether we have one point or multiple points per cluster. So a couple of minor improvements in that regard, and as I said, yeah, this has been implemented as a plugin for QGIS. So with exactly the same objective as you have just mentioned, to make sure that this tool or this process can be streamlined and shared as a simple tool that can be run by anyone, by the country itself. So that's where we are, and this is why this part was really interesting. I think Attila has already asked the question about your plans for this updated methodology of displacement, population-based displacement. So just flagging that we would be very happy to follow up and see also how how we can also collaborate or basically learn more about your experiences with that. We've also noticed some of the challenges related to just simple random displacement. But the question is here maybe have you do you have any timeline on that? Any additional papers or code that you would be sharing? And have you thought about some edge cases we have experienced in some countries, like displacement in island countries where you actually do not have many options to displace, probably even if you have a population grid as a proxy? So that's one question regarding this population-based displacement. And the second one, also extremely useful, extremely interesting part on the interpolation and geospatial modeling. And just one quick question regarding the impact of scale or resolution. You have mentioned that you were looking at admin level 2. I would expect that the level of at which you can run the analysis would actually depend on the size of the smallest units. So probably this may be different for different countries. And how does this relate to to the resolution of input data sets. You have mentioned that some of your input data sets are like 1 by 1 kilometer resolution or 5 by 5, 10 by 10. What is the? Have you thought about the impact of the resolution of input data sets, size of admin 2 or 3 units, and what is the impact on all these scale issues on the uncertainty of the analysis? Sorry for a long comment and a few questions, but happy to hear your feedback. Thank you.
Thanks, Jan. Over to you, Ben, Trinadh, Trevor.
Yeah, Trinadh, do you want to take the first one about the displacement?
Sure. Yeah. Thanks, Jan. So we've been working on the displacement project for now. This will be coming into our 3rd year. So to date, we have come up with 2 methods that we were exploring. One was that kind of modest improvement on our existing method, which is buffer-based. So we've just been calling it the population buffer approach. And we've also come up with another one, which is based on a mathematical relationship between population and the distance needed to, displace the point. We call that the equation approach. So what we've been doing right now is just kind of trying to tweak the buffer method and see if we can get that to a point where we can operationalize it. But we're trying to make sure that we don't just rush into getting this out, because the DHS method has been out for so long and that people have figured out ways of accounting for it in analysis that we don't want to just switch to something else and then nobody knows how to deal with it yet. So we're taking a much more conservative and cautious approach in releasing this. So to answer your question of kind of what are the next steps, I'm trying to make sure that we can do an analysis in-house of what is the impact of this new method on analysis, just so people will not be caught off guard if we decide to go ahead with this new approach. So that, I think, will be the focus of next year's work, and I think there's definitely there might be some room to collaborate from what you were describing about your work on it. So in terms of a timeline for operationalizing this, I don't think we necessarily have one. It's more so we want to make sure, because this could be a major change to a lot of groups, we want to make sure that we think about every potential implication of this before we get that out. Now, did that answer your question at all?
Yeah, thanks.
Okay.
Might I add one thing there? The methods that Trinadh's talking about rely on having population data. And one of the things we discovered in this process is that when we look at the point where the DHS cluster location is, it's not unusual that there is 0 population or very small population. Now, we know that we went and we conducted a survey at that location, and there must be a population there for that. But in the satellite data, or it's not really satellite data, it's the estimated data that comes from other sources, we're not finding population there, and it's not unusual. I mean, there's a good number of cases this happens, and that really throws these methods off, as you can imagine. So the challenge is having good data to be able to use these methods, not just having the methods. So that's one of the challenges we've been having to address. Ben, do you want to address the other issue about the modeling?
Yeah. So so number one, as I showed that we have the geospatial coverage given at a different resolution. So first we put them, at the same resolution, and generally for us we use the 5 by 5K, which I think I've shown to show later. Now in terms of the scale, especially you said how we relate the resolution to the input data for we have we have admin. What is the impact of the analysis on the probably admin 2, admin 3, given the scale. So what we do, first of all, yes, I know there are some challenges because we don't have some data. So for example, So for example, you know, if we say that we wanna, we use the population data set to help us, you know, aggregate the pixel level output, you know, to district level. So the advantage that we see here, for example, for our approach, you know, from just the pixel level, at least, you know, you can obtain estimation even at the smallest admin unit. So for example, we know some countries, you know, like Nigeria has so many admin 2 level, think over 700. And some of them even very small. And when you run your estimate, when you try to aggregate, you might find, you know, some method we have seen, like you aggregate and then you find there's nothing in that particular admin unit because it is very small. But at least for our approach, we we have seen that we are able to determine, or we are able to estimate, or to have values even for those small admin 2 for those small admin 2s. But I think in terms of now going back to see the impact of the analysis of the uncertainty, I think I can probably have like a more discussion with you on that. But at least just to answer you, yes, we have tried our best to make sure that have the same scale, and then run our model, produce the pixel level, and then do our best to aggregate to whatever admin 2 unit.
Awesome. Thank you so much.
Is that okay? You have more question on that? I'm happy to discuss.
I don't want to
with
take
you,
all the
but
time, but happy to
no,
follow
it's
up.
fine. Oh, okay, cool.
There are also
I'm
questions
sure
in the
we can have a bilateral conversation around these issues too later. But I'm just looking at the chat box questions and comments, and I'm seeing that some of them have already been responded to during this discussion, during these answers. But there's one which is about the following: how you model distance to health facilities in a rural area, considering the fact that people don't travel to health facilities in a straight line. We are talking about access and distance to health facilities, but to get to the health facilities could be quite diverse.
Yeah, I agree with you on that. So I think on that question, I'm happy to share I think there are like 3 papers. One on the modeling access to populated places, and then modeling time to health facility, but also distance to health facility. So at DHS, we haven't done that work, but I think we referenced that there are some groups that they have done that work, and I think they have explained like more into the method how they do that, because we know, yes, it's a challenge, especially when you talk about the straight line distances, you know, but I think they have taken into account so many other fixed variables into their modeling approach. So I'll share 3 papers, and I think you'll be able to see the method on that.
Thanks, Ben. I just remembered a day when Trevor and I were walking on 2nd Avenue with GPS receivers in our hand and then testing the receivers back in 2005, I think it was. But my question relates to the earlier part of your presentation, where you talk mostly about collecting GPS data. You showed the GPS receivers, and you referred to the tablets, which are able to get the GPS coordinates. But we know also, I think, that many of the countries now have geocoded enumeration areas. So rather than collecting such information during fieldwork or during listing, it is possible in a number of countries to get this data, already existing data, match with the clusters that you have in the DHS program. Can you say something about that? How much of that is happening, and how much is it you collecting the GPS coordinates during listing or during fieldwork?
Yeah, maybe I'll go ahead and answer that. Well, a couple of things. One, getting access to the GPS coordinates from the sample that's actually proved challenging, countries don't necessarily want to share that information at that point. So we haven't had a lot of success with that. But we also haven't pushed it that hard because we've actually changed our approaches a little bit, and we're now collecting GPS at the household level as part of the data collection, both in the listing and then in the main survey. And we're developing methods for being able to use a sort of a geo-enabled approach to be able to view all the households on a map while they're out in the field and make sure you fully listed the whole field, the whole cluster, sorry. And then to be able to use that information to help guide interviewers back to the same households for the main survey. This is sort of work that's still in progress, but it's sort of the evolution of what we've been doing. So we are now collecting both in the listing and in the main survey, and in fact we're collecting GPS not just at the household level, but we're collecting it in each individual interview as well. So because of that, we haven't actually worried about getting the information from the stats office or whoever it is that provides the sample. So we haven't really used that approach, but it has been used in 1 or 2 surveys in the past. We've got the GPS coordinates from the stats office directly rather than collecting it, but in most surveys we're collecting it.
Thanks, Trevor. That's an important point, I think, as we move forward also on the mix. Looking at the other questions, is spatial modeling similar to a statistical learning method called k-nearest neighbors?
Yeah, I mean it's one of the method. To my perception, you say yes, but I think it's more general. I think there's one paper, I think, on HIV that they did that. You know, it's a very simple approach that I think, you know, there are many things that need to be taken into account, because also it's like the first one when I said it's just a general simple kriging approach. So even the k-nearest neighborhood, I think it does the same approach, you know. So I think very difficult to see the uncertainty, and you should expect it to see like a lot of areas that I think they're not estimated as you'd like. So as I said in the beginning, I think when doing this kind of work, you really need to decide on the method that you want to go with. So if it's just a simple, just very basic interpolation, you know, just to see how things they look like, yes, you could. But I think you want to go into more detailed and considering all issues of uncertainty, you know, making sure that your model is robust. I think you might want to go into a higher level of modeling approach.
Thanks, Ben. We have only 4 minutes before 10 a.m., but just a question that came just now from Rob, is which is sort of related to the topic. Is the DHS team exploring spatial sampling approaches for countries with really old sampling frames? Trevor was making a point about finding households where population grids suggest they shouldn't exist is particularly troublesome. An additional comment is.
Yeah, we've looked into some of the other sampling approaches, you know, particularly the work that some people at the University of Southampton have done with, say, with gridded samples, for example. But to date, we haven't actually applied these methods because in the estimation of our sampling specialists, the approaches that we traditionally use based on the traditional sampling frames are generally better approaches, and we haven't had a situation where the quality of what we're working with is so poor that we have to use other methods. our samplers have done some work looking further at this. I don't know a lot of the details, but it's not, you know, they're interesting approaches, but they're not approaches that we've used to date.
And they're quite recent approaches, I think, that are still experimenting with it, I think, to a large extent.
Yeah.
You're right, Trevor. Thanks. Okay, well, good discussion. Great questions from participants. Thank you so much to everyone. And thank you so much to Trevor, Ben, and Trinadh for this fascinating presentation. This is great work. Congratulations.